Hey everybody, I'm back again. Let's talk about Petrissage. So with Petrissage, what this does is it's going to compress, lift, and squeeze the muscle. So our premise is to lift the muscle off the bone. So if we have too much oil, we're not going to get that lift, right? So that's our mantra when we're doing any type of the Petrissage. It's going to be compress, lift, squeeze, right? Most of the time, we are going to be in a warrior stance, right? So we're going to be working, or a horse stance. We're going to be working in front of ourselves. There are going to be some times when we're in a lunge, if we're doing fulling, right? So let's get a little bit of the draping out of the way. I'm going to show you most of the other strokes on the legs. And again, before we do Petrissage, we're always going to do effleurage first. Why? Spreads our oil, warms up the tissue for the deeper strokes. And Petrissage is one of the deeper strokes. So I will be doing superficial effleurage. You'll see me doing circular effleurage, which we just talked about. And you'll also see me doing deep ironing before I get into the Petrissage. Okay, so let's undrape. So draping. First thing, get the person ready before you do the drape, right? So I'm going to have you bring this leg out towards the edge of the table for me. Good. This leg out towards me. Excellent. So I'm going to get all of the sheet into the middle. I'm going to come up to the edge of the hip, hold, grab by the knee. I'm pulling up from the bottom, not from the top. If I pull it from the top, I'm going to expose your shoulder, which we really don't want. We're going to tuck mid-thigh. We're going to fold this up out of the way and then tuck at the hip. Now, her hand's going to be in the way when I do my circular effleurage. So I'm just going to move this off the table. Okay. Now, if you're worried about the sheet moving, we can always place a towel over the sheet to hold it, or your blanket. Okay. So again, I'm going to be doing superficial effleurage, circular effleurage, and deep ironing before I get into the Petrissage. And again, our boundary is that sheet. We don't go underneath that boundary. With effleurage, we're in our lunge because we're traveling up. And now that I have that area warmed up, I can get into my Petrissage. And there's going to be variations of Petrissage. One of the ones that we use is a CV. So our hands are kind of like in a C and a V, if you think about it. You're picking up the tissue, holding it, squeezing it, and then the other hand is picking it up. Right? So that tissue should never fall back down to the bone. Then we have ocean waves. Our hands, thumbs are together. Hands are opposite each other. We push in, lift, squeeze, let it drop. Push in, lift, squeeze, let it drop. Push in, lift, squeeze, let it drop. The other one is fulling. We're using the heel of our hand, spreading the tissue, lifting and squeezing, spreading, lifting and squeezing, right? So what's our mantra for Petrissage? Compress, lift, squeeze, okay? So I'm going to go through all of the variations for you. I'm going to do them on the posterior thigh and also on the gastrocs and soleus. So it's usually a lot easier to learn these on the gastrocs and soleus. So if you're going to be practicing, I would suggest practice here first. Hamstrings are a really flat muscle, so sometimes it's hard to get a hold of them for CV, okay? And depending on the size of the body on my table and the size of my hands, that is going to dictate how many passes I make. So usually I do a medial pass, a middle pass, and a lateral pass, right? She had bigger thighs, I may add an extra one in there. If she had smaller, I may add one or two. So again, compress, lift, squeeze, compress, lift, squeeze. And again, I'm using my body to do the stroke, right? I'm in horse stance. This is how I'm working, right? Now, as I'm working, I also have to worry about my body mechanics, right? So as you work, you should always have soft knees. That allows you to move. You should always have a pinched penny or a posterior pelvic tilt a little bit, okay? So that's going to protect your back. If you don't do that, you're going to end up with back pain, right? So again, compress, lift, squeeze. And as I want to get to this lateral side, I'm going to drop way down in my stance. So this is right in front of me. If I don't, then I'm trying to do this. Not good for my body mechanics, right? So as I come in, so that's CV. I'm going to effleurage that out. Ocean waves are coming in this way, compressing, lifting, squeezing, let it in, drop. And again, I'm using my body. Okay. And then we have fulling. Wherever my drape is as far as my hand is going to go, right? So I have a lot more space out here, a lot more surface area. So I can come out. This inside hand is only going to stop mid-thigh. And then effleurage it all out. So again, superficial effleurage, deep effleurage, deep ironing, CV, and CV, anything on the extremities, centripetal. Always has to go to the heart, right? So any pressure that you're doing towards the heart, as we come back down, it's lighter, so you're not pulling fluid. In my head, I think of an old school typewriter. And when I reach that popliteal space, ding, I slide back down. I usually don't do it out loud, ding, because people think it's weird. Ding, and again, the size of the body on your table is going to dictate how many passes, right? If they have a bigger calf, I have tiny little hobbit hands, you're going to have to make more passes. If you have big hands, this may only be one pass for you, right? So again, my body is behind my stroke. I'm not all shoulders, okay? If you're all shoulders, you're going to end up hurting yourself, okay? Get your body behind your stroke. That's where your power is going to come from. Ocean waves. Fulling. Fulling, you're in a lunge. You're dropping down, standing up to help. Effleurage everything out. And a feather stroke off. When you go to redrape at the hip, pull straight down the table, and even out your sheet. So what I'm going to show you on this leg is everything that I just mentioned, everything that I just showed you, without me flapping my lip over it. Okay. Okay, so those are some of your basics. A little bit of effleurage tutorial and some Petrissage. Blah.